Hello students, continuing with the lecture of ear. Today we will discuss the middle ear. Now middle ear or tympanic cavity or tympanum is what? It is a bony cavity within the petrous part of the temporal bone, lined by mucous membrane and filled by air. Now the functions of the ear basically is in middle ear is that it intensifies the force of sound vibrations and conveys vibration from tympanic membrane to the fenestra vestibuli by the movement of ear ossicles. Now this is the diagram showing the middle ear. In this the ear ossicles they are visible. So this is the tympanic cavity. On this side there is tympanic membrane and here the internal ear is lying. Now the shape of the middle ear is a cube-like structure. The parts, it has two parts basically broadly, that is tympanic cavity proper, which is lying opposite to the tympanic membrane. So this is tympanic cavity proper. Then epitympanic recess lies above the level of tympanic membrane. Now coming to the walls of the middle ear. So as it is a cube-like structure, so the structure is having 6 walls, that is roof, then floor, then it has anterior wall, it has posterior wall, and above, which is facing here, this is the medial wall, and here the closing this box is the lateral wall. Now coming to the roof is formed by the tegmen tympani, which is the part of the petrous part of temporal bone, which is separating the middle ear from the temporal lobes of cerebrum. Now the floor is also called as jugular wall. It is formed by thin plate of bone separating the middle ear from the superior bulb of internal jugular vein. It is related to the jugular fossa of the petrous temporal bone. Coming to the anterior wall, upper part has opening for the canal of tensor tympani, middle part has the opening of auditory tube, and the lower part is separated from the internal carotid artery by a thin plate of bone. So 3 openings they are present. Basically 2 openings are there and 1 bony plate is there, which is separating the middle ear from the internal carotid artery. Now structure which are visible on the posterior wall are, that is additus to the mastoid antrum, then fossa incudis lodging the short process of incus, then pyramid eminence which is formed by the stapedius muscle, the tendon of the stapedius muscle emerging from the conical bony projection of pyramid and attaches to the neck of stapes. Then vertical section of the facial canal is visible in the posterior wall. Then posterior canaliculus, which is the opening of cauda tympani canal. Now mnemonic is AFP, FC, A for additus, F for fossa incudis, P is pyramid eminence, F is facial canal, and C is cauda tympani canal. So these are the structures which are visible in the posterior wall of the middle ear. As I have told you that it is a cube like structure which has 6 walls. The lateral wall of this is formed by tympanic membrane. So this is the lateral wall. Now opposite to the lateral wall is the medial wall. We call it as the labyrinthine wall, which separates the middle ear from the internal ear. So on this side the tympanic membrane is there, on this side the medial wall is there. So this is lateral and this is medial wall. Now what are the structures which are present on the medial wall of middle ear? One is promontory. So this is the promontory which is visible, formed by the first turn of cochlea. So first turn of cochlea, it forms the elevation in the medial wall of the middle ear. So that is promontory. Then oval window, which is also called as fenestra vestibuli, which is present behind and above the promontory. So this is the oval window you can see here. Then round window, that is fenestra cochlea, which is present below and behind the promontory. It opens into the scala tympani of the cochlea. Now this vestibule portion of the internal ear, and this is closed by the foot plate of stapes. So this is oval window which is closed by the foot plate of stapes. So these structures are there. The next structure which is visible in the medial wall is depression behind the promontory, and the name is given sinus tympani. Then bony canal for facial nerve. You can see here the prominence of the facial canal. After crossing the internal ear, the facial nerve turns abruptly in the posterior direction just above the promontory. and this bend has geniculate ganglion, then proceeds backward in the medial wall and descends in the posterior wall of the middle ear and emerges through the stylomastoid foramen. Now, next structure which is visible in the medial wall is prominence of lateral semicircular canal. So these are the structures which are visible in the medial wall. This was the anterior wall in which these structures are there, tensor tympani, then this pharyngotympanic tube, thin plate of bone separating it from the internal carotid artery. In this you can see the adductus to mastoid antrum, then there is the pyramidal eminence is there, the chorda tympani canal is there. So these things are visible on the posterior wall. Floor is separating it from the jugular vein, internal jugular vein, and roof is separating it from the temporal lobe of the cerebrum. So this completes the cavity of the middle ear. Now this is again diagram which is showing that various structures. So lateral wall is formed by the tympanic membrane. Then medial wall has these structures, that is promontory, oval window, round window, prominence of the facial canal, then prominence of the lateral semicircular canal. In the anterior wall, these are the structure canal for tensor tympani, auditory tube, and bony plate separating it from the internal carotid artery. Then there is a thin plate of bone which is separating the wall from the internal jugular vein, so that is forming the floor. Then roof is there, that is tegment tympani separating it from the temporal lobe of the cerebrum. And in the posterior wall, so this is the posterior wall in which these structures are there, that is adductus to mastoid antrum, facial canal, vertical part of the facial canal, then pyramidal eminence, then posterior canaliculus for the chorda tympani canal. So this is the diagram showing the various walls and what are the structures they are visible in the different walls of the middle ear. Now we have discussed that this middle ear has the tympanic cavity proper and it has epitympanic recess, but part of this middle ear cavity is extending downward also. So keeping in mind, so we divide the cavity into epitympanum, which is just above the level of this tympanic membrane, then mesotympanic just opposite to this tympanic membrane. This cavity is given the name mesotympanum, and part which is just extending into the bone present in the lower portion, that is hypotympanum. So this is further we can say the classification of the middle ear cavity. Now the communication of the middle ear, it has with the lateral wall of the nasopharynx through auditory tube. It maintains the equal pressure on either side of the tympanic membrane. So this is middle ear cavity, and posteriorly it communicates with the mastoid antrum through which it communicates with the mastoid ear cells. So this is the adductus to mastoid antrum through which it is communicating with the mastoid ear cells. So the structure is somehow like a gun, you can see. So this is the structure which is showing the communication with the eustachian tube on the lateral wall of the nasopharynx and posteriorly with the mastoid ear cells. Now if we see, we have discussed the various structures which are present in the middle ear. If we see the content, what are the contents of the middle ear? It has ear ossicles, there are three, that is malleus, incus and stapes, they are visible. Then two muscles, that is tensor tympani muscle and stapedius. This tensor tympani muscle produces the tension in the tympanic membrane, and stapedius is attached to the stapes bone. Then various vessels which are going to supply this region, that is anterior tympanic artery, stylomastoid branch of the posterior auricular artery, then branches from the middle meningeal artery, then ascending pharyngeal artery, artery of pterygoid canal, and tympanic branch of the internal carotid artery. Next is the nerves which are supplying the tympanic cavity, which are supplying the middle ear. Then next important component of the middle ear is air. So these are the contents of the middle ear. Now coming to this condition, that is otitis media, it is commonly known as middle ear infection. So it is characterized by the inflammation or infection of the middle ear following a cold, sore throat or respiratory infection. So particularly the children, they are more prevalent. Then there are three types, that is acute otitis media, then chronic suppurative otitis media with effusion. This acute otitis media, it is a sudden onset of infection or inflammation in the middle ear. And chronic suppurative otitis media, it is a persistent or recurrent inflammation or infection of the middle ear. Then otitis media with effusion, the fluid accumulation in the middle ear without active infection. So these are the common types. Coming to the next topic of the middle ear, that is auditory tube or eustachian tube. Now it connects the lateral wall of the nasopharynx, we know it, with the anterior wall of the middle ear, that we have discussed. Then function is it maintains the equal pressure on either side of the tympanic membrane. Through the middle ear, it conveys air to the mastoid antrum and mastoid air cells. So this tube is open. It opens during deglutition, yawning, and sneezing. Length of the tube is around 36 millimeter or 3.6 centimeter. It has the main parts. There are two parts, but third part, isthmus, is the narrow part between the two major part, that is lateral bony part, and which is 12 millimeter or 1.2 centimeter, and medial cartilaginous part, which is 24 millimeter or 2.4 centimeter, and the junctional point between these two parts is given the name, that is isthmus or narrow part. So mainly it has two parts, that is lateral bony part and medial cartilaginous part, and total length is 36 millimeter or 3.6 millimeter. Out of this, the cartilaginous part is of more length, which is 2.4 centimeter or 24 millimeter, and lateral bony part is smaller one, and it is 12 millimeter or 1.2 centimeter. Now this is, you can see the bend over here. So this is the isthmus portion. Now coming to the lateral bony part, so it is location is into the bony petrous part of the temporal bone. It opens laterally in the anterior wall of the middle ear, and medially it continues with the cartilaginous part of the tube. Now medial cartilaginous part, it is partly cartilaginous and partly fibrous, made up of elastic cartilage. Location is in the groove of the base of skull, that is sulcus tubi, between petrous part of the temporal bone and the greater wing of sphenoid. The medial end of the cartilage, it projects into the lateral wall of the nasopharynx as the tubal elevation. The medial lamina of the cartilage, it provides attachment to the three muscles, that is salpingopharyngeus muscle, then levator veli palatini, and tensor tympani muscle. So medial lamina is giving attachment to these things, and the lateral lamina is giving attachment to the tensor veli palatini muscle. Blood supply of this tube is branches of ascending pharyngeal artery, middle meningeal artery, and artery of pterygoid canal. And nerve supply is lateral part of is by the tympanic plexus, which is derived from the glossopharyngeal nerve, and medial part by the pharyngeal branch of pterygopalatine ganglion. Now if we see the difference of eustachian tube between adult and children less than 7 years, so length is in adult it is 36 millimeter, and in children it varies from 18 millimeter to 36, and in infant it is 18 millimeter. Angle width horizontal is 45 degree in case of adult, but in case of children it is 10 degree. Lumen is narrower in case of adult, and in children it is wider. Angulation is present in case of adult eustachian tube, but it is absent in children. Then cartilage is rigid in case of adults, and it is flaccid in case of children. Elastic recoil is quite effective in case of adults, and in children it is ineffective. So these are the basic differences between the eustachian tube between adult and children. Now if we see the applied anatomy, eustachian tube connects the middle ear with the nasopharynx. Tube helps in the draining the fluid from the middle ear and balance air pressure inside the ear. Allergies or infections affect auditory tube, can cause its dysfunction. So these are the major two functions. If allergy or infection is there, then the blockage of the auditory tube it happens, which can cause the dysfunction of the eustachian tube. Now for that, if there is some blockage in the eustachian tube is there, the Valsalva maneuver is preferred. So what is that? Close your mouth, pinch your nostril closed, breathe out as hard as you can. So definitely it will build up the pressure, and it will try to open the eustachian tube. So this is all about the middle ear, and which includes the middle ear cavity and eustachian tube. So if you like my channel, I again request you kindly subscribe it, share it, and give some comments if you like my videos. So definitely it will motivate me to make more videos. Thank you.